Okay, guys, welcome back to another episode of the Unweighted Life podcast. I'm Ashley. This is Suzette, the visionary and founder of LH Spa and Rejuvenation, and this is Nurse Meg. She is the nurse that I did the Semaglutide with at the med spa, which is that one. Today, we're going to just be talking about a couple of different things. We wanted to kind of touch on some questions that I've been getting asked about if you have certain issues with your thyroid and you're on specific medications, if it's okay to be on Semaglutide, the effects that it could have with antidepressants, and what was the word for it that we used?
Like mood stabilizers?
And there was another word, I have it in my notes.
Stimulants?
And then just like why you should get off of it before taking on a surgery, the rules and stuff behind that. We'll talk a little bit about injection sites,
Shelf life.
shelf life of the medication, all that. So just we're
It's
gonna
a
be
lot
all
of
over the
information.
place, but we're gonna kind of just tackle a few of like the main things that we've been seeing and really get into that. So first off, I feel like a big one that is always coming to me is like, what type of thyroid issue would it be that you can't be on semaglutide?
So there's a lot of hype about thyroid cancer and this medication. Remember that this is a class of medications. It's been around for decades. I'm a big proponent of explaining that it's not a new class. It's just a new application of use.
Beautiful
And right? And I think it makes sense too to like anybody, hopefully. But rodents in studies, rats, mice, they usually do studies on, that's most of our studies of a lot of things. And in those studies, an older drug within this class, they developed tumors. In humans, it hasn't been reported yet or at all to date, but anyone with a personal or family history of medullary thyroid tumors, we just don't treat them.
Gotcha.
There's mention in some studies that we don't even have the receptors to potentially have that happen in humans, but I think they just don't want to touch it because they're like, why? It's a very rare type of thyroid cancer. There's like papillary thyroid cancer, there's other types. So those other types are not a contraindication, but specifically medullary thyroid cancer is a problem. Now, people that have hypothyroidism, meaning it's not functioning as efficient, or hyper, meaning it's over functioning, those are two types of thyroid issues. It's not a contraindication. If you came in and said like, I have Hashimoto's or I had a thyroid issue, I wouldn't say you're not a candidate. I would just want to know that, because if you're taking Synthroid, which is a very levothyroxine, very popular thyroid medication, it helps provide more of the hormone activity. You would want to make sure you take that on an empty stomach.
Okay.
So Synthroid is very important that you take first thing in the morning. Like me in the hospital giving that out, I used to have to wake up patients at 6 a.m., 5 a.m. and give it to them way before their breakfast came. And it has to be on an empty stomach. Okay. So it can affect its absorption if you don't take it correctly, especially because this delays your gastric emptying.
Okay.
But in general, they are doing studies suggesting that it should assist patients with their symptoms if it's taken correctly.
Okay.
So it shouldn't be a straight like, oh, you have this diagnosis, I can't treat you, but it has to be part of the conversation, because I'd probably ask you a few extra questions related to that illness throughout the program.
Okay.
Because those patients are at risk for fatigue, low energy, constipation. Imagine throwing this in on top of that. Now you really have to make sure you understand what your baseline is. That's something I would probably want to baseline before I start.
So now how about like the different types of diabetes too? Like, is this able to be given to type 1, type 2?
So type 2, yes. And in studies, the way this was originally approved was typically, and you hear me talk about metformin all the time, and I even prescribe that for some of our patients on top of this. Typically, it's supposed to be the way it was designed. And I was just reading my old pharmacology textbook because I'm a nerd. I was reading it with my 2-year-old. And I found a chart, and you're supposed to add in, it used to be metformin first. That was the algorithm. You always added in metformin first. Then you added in potentially another oral anti-diabetic from a different class. And then you would add in this class. So it's almost like a triple threat before even getting into like your straight up insulins. So this was originally designed as like an adjunct therapy, and now we're kind of getting people right on it first. So type 2, not a contraindication.
Type 2 is eating induced diabetes.
And typically
right?
develops later in life. Like that's more of like your lifestyle diabetes. Not always, but some people over time. That's the one you hear about where people are diagnosed later in life.
Both my grandparents were diagnosed, and they like shit.
Too.
Right.
But it wasn't.
People always associate with that, where type 1 is like your kids. Like a lot of times you hear about kids being diagnosed with it. We actually had a patient who I remember speaking to after the COVID. She got the COVID vaccine, either the vaccine or she was sick with COVID, and she developed type 1. And that's thought of like an autoimmune where you no longer produce it at all. Where with type 2, you produce insulin typically, but it's not enough.
Okay.
And that's why this helps with that process, because you hear me going on and on about the insulin resistance. Type 1, you lose the functioning. Like, it's not happening at all. So it's not studied. Like, if you ask somebody and say, what's a contraindication for this class, they're going to say type 1 diabetes. And typically that's just because it's not really studied for that population. I'd be willing to play around with it. I've had maybe one patient I can think of, but she was wearing a continuous glucose monitor. That's the difference. So she has something on her that's constantly managing and monitoring her blood sugar, not a pump, just a monitor.
Yeah, the
so
little
it's always
white thing, right?
Yep.
Or it just
So it's always telling her what her blood sugar is. That's somebody, and she also was trustworthy, where I knew that she was eating enough, eating throughout the day, really aware of her blood sugar, and was responsible. Somebody that's not responsible and they're just eating a bagel, a piece of cake, like they're gonna have the highs and lows. I wouldn't, and they didn't have a continuous glucose monitor, I would just say it's not. But those are like the main.
I always get that comment. They're like, I'm a type 1 diabetic. Can I take this? I'm like, I don't know.
It's not approved technically for that, but you do have providers, and it is being studied. So I just think people have to understand the difference as to the difference, like between the two, type 1 and type 2. And that's not necessarily for a layperson to know, but I think it's good to know why.
Right.
Yeah.
And now what about like antidepressants and stimulants, like we were saying before, like any anxiety medications?
You have your daily medications, ones that are not as needed. So your benzos, like your Xanax, and ones like that are more for as needed. I'm having a panic attack, I need to take one. I always remind those patients, you can't prevent a panic attack or know, oh, I'm about to have one, but it might not be as effective as quickly. It's going to take time for it to dissolve and absorb. But your daily ones that you take every single day, like your Zoloft, your Prozac, you just have to make sure you're taking them every day.
So you're
Same
saying
time.
like the Sema wouldn't act as that, or
It's the Semaglutide, because it delays gastric emptying, it's going to affect that absorption in your gut.
Okay.
So if you're taking pills that you think are going to kick in right away, like an as needed, like a Tylenol or a migraine medication or a Xanax, those are probably the three that people ask me about.
Okay.
It's not that it's not going to work, but you might notice it doesn't work as quickly.
need a little more
The onset is a little bit slower, and that's not something that I can say is proven, but if you think about how it's working, that makes the most sense
No, it
to
does.
me.
Yeah, I didn't realize that that was why. But I guess a lot of it has to do with the gastric.
But I will
emptying.
just say I never take Tylenol, and Monday I had the worst headache, and I took Tylenol, and I actually sat there, and I remember saying this out loud. Wow, Tylenol works so fast. I don't want people to freak out when they hear this because
It's not going to not work.
Right,
Yeah.
Yeah.
right. Okay.
It's just something to consider.
Yeah.
I don't want
I've
someone on an
never-
airplane being like, I'm having a panic attack, and Megan never told me that maybe it might be. I want people to
Right.
know,
I
don't
never
wait
noticed.
until you're off the cliff
Right.
and then
Right.
trying to
So
pull
then-
yourself back up. Yeah.
Right.
Okay, good to know. So, but
Stimulants,
all in
same
all,
thing.
They really don't have like a major effect. It's if anything, just time that it actually hits you. So it's like a structure. Like,
Yeah. And your stimulants, like your ADHD and your ADD medication, remember, for a lot of patients, that does cause tachycardia, which is like an elevated heart rate, nervousness, inability to sleep. It actually does suppress your appetite. So just remember that as your baseline for your Ritalin and your Adderalls. That already is caused by that class of medications. So you might have a issue with over restricting someone's appetite, because now semaglutide does as well. But in general, if you're having the anxiousness, the nervousness, this and that, I always ask at the initial consult already, what else are you taking?
Right.
Because to me, people are so quick to blame the semaglutide, and I'm like, you've been taking a
notice that?
stimulant
They
for how long?
Always blame the semaglutide.
Yeah.
First.
Everyone blames
Always.
it. I just had this argument not too long ago with someone, and I was like, everyone just wants to blame it. Like, I get a headache, they're like, oh, it's probably the semaglutide. I'm like, no, I just have a fucking headache.
Yeah.
Or like, oh, my stomach's hurting today. Oh, well, did you take your I'm like, shut the fuck up.
Yeah.
Also,
I don't know why people hate on
phentermine,
it
we're handing out phentermine still like it's candy, but they're coming in and saying to me, I'm just concerned about my heart with this. I'm like, well, this is supposed to, it's actually cardioprotective,
Yes.
so maybe ditch the phentermine and let's get you over to the safe side.
Yeah.
Like, I don't understand.
I really
I
need
love
to
that.
understand why.
That it's heart healthy. My aunt the other day goes, this one had a heart attack because the semaglutide. I was like, yeah, that doesn't sound right to
Listen,
me.
my mother is a fen generation, and she was lean, and she was always uptight, and a lot of those people have heart issues.
Yeah.
And
Yeah.
she's so happy.
One of our original people on this, he is on blood pressure medication, and I'm not saying anything was caused by anything, but he was on that in the past, on the phentermine,
Yep.
and he was having fast heart rate, he was anxious, he couldn't sleep, his blood pressure was elevated. Like, that's literally how that works. It's a stimulant. So
I can
I'm
never
not,
do that.
everything has side effects.
I couldn't even do a fat burner. I used to try to do that before I worked out.
I did a yellow jacket a couple times. I was like legit walking in circles.
Even like the pre-workout.
Yeah.
Yeah,
All those
right.
drinks, I could never do that. I used to do them all the time.
So I'm not
So
like,
bad.
listen, everything has its risks. I'm not saying like we have to be, what's the word? We have to present both sides of this. We can't, we try not to be biased. We sound pretty biased. However, we also have to consider other things we're putting in our body. Like if you have 2 benzos, you're taking a Xanax every night to go to sleep, no judgment. But let me just say the withdrawal coming off of that is very different than the withdrawal coming off of this.
You have
Like
every
it's
right to be biased because you're watching something improve the lives of so many people, and there has yet to be a truly negative.
to the amount that you see
Yeah.
with these other medications.
Correct.
Again,
If you're
we could go into
comparing
this
it to-
opioid crisis. Like you don't hear
Right.
No.
we hand out
Right.
opioids after getting your wisdom teeth removed, but we're worried about the semaglutide. Watch
Right.
out.
I know.
Watch out. You're going to lose weight. That's
We
the worst
also
thing in the
have
world for
aspartame
you.
as an ingredient that's allowed to be on the market in America. So
Banned everywhere else.
Do you know that?
I love
is it-
aspartame, by the way.
Do you know that in Europe, Skittles is banned?
yeah, red 40,
the dye.
red 40.
I'm like-
red 40 is illegal in Europe.
My brother
Illegal.
was telling me because she just came back from Italy, all the things that are banned, and I'm like, we have. them
What's
here,
that
like,
other one? Gluca. There's a
Even
ingredient
cereal,
that's
cereal.
in.
So-
I was listening to a doctor. I'll send it to you later. It was like this one ingredient that is literally illegal in other places of the
Frosted
world.
Frosted Flakes. Tony the Tiger
because
is illegal.
Because it has it's
We don't keep any of that in my house just because I feel like it's just so easy to introduce that to your kids
scary.
because they're friendly. Like the toucan from
Yeah.
Fruit Loops,
He's so
Tony the Tiger. Like
Yeah.
we could go off on a tangent all day
I
about
love Cocoa Pebbles.
and just look at the box
And
one day.
Cinnamon Toast
Look
Crunch.
No, I
at the
won't even
label.
look now.
Look at the label. Look how much sugar. I can't even buy my kid yogurt pouches because they don't have yogurt pouches for babies without added sugar. Why are you adding sugar to a fruit and yogurt pouch? It's already
When I'm
naturally
pregnant, I'm
sweetened.
calling
Right.
Meg and I'm gonna be like, help. What do I give my kids?
I know.
Scary.
You have to make everything at home.
So I know we've had a conversation on a podcast about birth control, but does birth control, they're saying that like people are becoming super fertile while being on this. And basically I've heard a couple times birth control doesn't work similar to an antibiotic.
Same idea.
Okay, so you're saying that the birth control is basically getting canceled out by the semaglutide?
I don't think it's getting canceled out, but if they're not taking it on time,
It's a lot more risky than if like you weren't on this and not taking it on time.
yeah, because it definitely there's got to be some level of change in the absorption. And I also do think there are some people who aren't getting pregnant because they really wouldn't have been able to get pregnant anyway.
Right,
And that's
right.
not everybody.
Yeah.
But I think there's some people who do have a metabolic issue and some inflammation that's actually helping them to not get pregnant. And then once they kind of fix the problem with this,
Right.
all of a sudden
Right.
they're pregnant.
Yeah.
Happened to 2 of my patients so far that we know of. 2 patients. One that thought she was infertile. They had done like IVF. They'd done all these things. And then the
just
other
simply
one
lazy.
was not planning
Yeah.
and had never tried and then was like living with a boyfriend and was like, yeah.
Wow. Oh well. We've seen some Ozempic babies. They're fine. People have messaged me on TikTok saying like, because I've talked about how you shouldn't get pregnant while being on it, not because there's any crazy studies
Yeah,
saying
but
anything's
also
wrong.
they're on it and they find out and they've
Stop taking it.
yeah. Like if
Well-
I'm a week late and I'm like, oh shit, I'm pregnant and I'm on semaglutide and I stop, I don't believe the
I
baby
don't, yeah.
has it yet.
I think you have a grace period.
Well, people drink, people smoke weed, people are
Yeah.
smoking
No, but
cigarettes
no.
in the beginning, and then they find out, and the babies are all.
That's what I'm
okay.
saying. Like Ozempic babies, like
Yeah.
well, you're not like, oh, I'm pregnant. I'm going to continue.
Yeah.
I
taking
think,
it.
well, yeah, because everything is absorbed through the placenta. So there is
Right.
a certain point where you don't all of a sudden just get pregnant and have a placenta.
That's
Like
it.
that takes
It's
time to
the
develop.
protective-
Right.
It's
And that's where you're
right.
getting your nutrients from. So if you start drinking, doing drugs, whatever, and it's
Right.
absorbed into the placenta, that's directly what's like technically supplying nourishment to your child. So
Right.
yeah.
But like even they say like in the beginning, like you're not supposed to go on boats or on rides or do anything like vigorous on your body, but you're given like a grace period. I've heard this too, where basically
You
like
want to know what I'm thinking right now?
tell me.
You're not supposed to
I'm
go on
scared.
a boat because the egg and the sperm just made this little baby,
you're-
and now you're bouncing them around. Is there no truth to that? No.
Oh, I think it does. I think part of it is like implantation.
Implantation.
Yeah.
implantation. That's it.
That's exactly what I mean.
How long does implantation take?
Yeah.
I honestly, at the
That's
top of
another,
my head,
that's another
yeah.
podcast.
I will have to.
That's
I'll have
another
to read up on my
episode.
fertility studies. I didn't do any of
I
those
think
things
this is
because I was
important 'cause I
so
don't think people
regimented
know.
that
Right.
the world knew that I was attempting, so I didn't have any of those issues. But
Right.
it happens all the time.
Right.
And I think one of you just said that. I'm not sitting here saying this is going to be poison to an unborn child, right?
Right,
Like,
right.
I think it's just because it hasn't been studied. Like, we give metformin to
what
pregnant
pregnant
women
woman's gonna
purposely
offer
to maintain
themselves.
pregnancies,
Right.
because it's helping with that insulin problem and the blood sugar control and the inflammation that's usually contributing to their lack of carrying the pregnancy.
Yeah.
So people who've had multiple miscarriages, they usually
makes
give
sense.
hormonal support like progesterone to help support the uterus and keep it stable. And they also provide like a metformin. Sometimes it's a thyroid issue. They'll have them on Synthroid. And then once the pregnancy is over, a lot of those symptoms they won't treat anymore with those medications.
Gotcha.
I love learning.
I do too. The other thing I wanted to talk about is the why behind it's so important to get off of this prior to starting a surgery. I feel like a lot of people don't know that.
Oh, yeah. And I've had patients come in and say to me a month later, I had this and I had that. And I'm looking at, they're like, and I took this dose, and I'm looking at them and I'm like, tweaking, like, you didn't tell me any of this. I would have told you to get off it. Well, and I'm like, well, did you tell your anesthesiologist? No, I just didn't think it was their business. And I'm like,
Because people are scared, and
I know.
and I understand that
Yeah.
little bit of fear, because I went to especially being younger and looking like what I look like right now. People look at me and they're like, you didn't need to lose weight. Yeah, that's fucking easy for you to say if you're looking at me and I'm down 30 pounds already. But if I showed you those pictures, yeah, you would think that.
and if
maybe I
you
needed
said
to
you
lose
had
some weight.
like high blood pressure, they wouldn't be questioning whether you needed to be on blood pressure
Of course.
medication.
And when I went to my physician for the first time after, he was like, what medications are you on? And I really didn't want to tell him, because I was like, I'm already under the supervision of a medical provider. Like, does he really need to know this? And I was like, you know what? It does need to be on my record. So I told him, and he's like, okay. And I was like, oh, you're not mad? I was like so nervous you'd be mad, because this was like right after I had kind of started. I was at my goal. He was like, wow, you're down 30 pounds since your last physical with me. It might have been like 20 something pounds, because I wasn't that heavy. My last physical, I got heavier. And he was like, my cholesterol was, the numbers, the improvement was insane. It was like a crazy amount of points, like 20 something points it increased by, or whatever the better improved by. And he was like so excited, and he's like, listen, I just don't prescribe it because the insurance and everything, it's difficult. He said, but I support it. Like, your numbers are here to show it, and this is the way of the future, and we all have to get on board until they fucking ban it. But
my husband was the same way, and we talked
get
about that.
the fear.
Going into his physical that year, he had just started it, and it was like a few months in. And again, he has the family history. He's obese on paper.
Yep.
Looking at him, you'd say the same thing. He doesn't need it. And then, so he had that mentality going, and being a male.
Yeah.
Like, males are not allowed to admit that they want to lose weight and like be healthy. So he went into the appointment all like self-conscious about it. He disclosed it to his nurse practitioner, and she was like, that's great. Like, everything looks good. Keep me updated.
Yeah.
Where are you getting it? I'm wondering for some of my patients. And she was like, just, thanks for letting me know, because it is a medication.
Yeah.
The reason you have to hold it for surgery is because when you go under anesthesia, you're at risk of aspiration. And that just means you can vomit while you're under anesthesia. And it can, if your gastric emptying is delayed, now you ate a meal and you're supposed to fast, let's say for 12 hours, 8 hours, the food is not digesting as quickly as it was when people weren't using this. So now they have food contents in there that they shouldn't have there anymore. And that 12-hour fast, that 8-hour fast is no longer sufficient to really clear out their stomach.
Makes sense.
So then they're aspirating. So when people think it's a joke, like, I'm just not going to tell them. No. Listen, I can't call up your provider for you, but just understand why we're asking you to hold it. And you don't need to come tell me about the people don't want to tell me, just like they don't want to tell their surgeon about this. They don't want to tell me about their breast augmentation.
Right.
I'm not going to judge you. I just have to know, because
Yeah,
it also
it's
affects your recovery.
Understand what is wrong?
I know. I'll tell.
I think it's
tell
a
everybody
stigma.
It's a stigma. It's a fear a little bit, especially like I'll tell everyone anything, literally open book. I'll say it on the fucking internet, but when it comes to actually having that conversation with my doctor, I get like a little like, ooh,
You think you're going to get yelled at.
judgment. You don't want the judgment, and it's like,
And I think also people are lazy. How about when they don't want to fill out our forms and we're like, you're doing a medical like a service.
Correct.
We need to know your medical history. Oh, just put anything down. Fill this out for me. Legit, they don't want to fill out the paperwork. That makes me wild.
that's crazy. So how long before surgery is it recommended to be?
The anesthesia guidelines, like from the Universal Academy, I want to say it's like the American Anesthesia Society, they say, I think 2 weeks.
Okay.
10 to 14 days.
Okay.
Some people do more just because they're nervous.
Right.
Fine.
After your surgery is done and you're wanting to get back on it,
There's no real guidelines for that yet, right? Because anesthesia, all they care about is the pre-procedure. And then afterwards, I don't think it's a bad idea, especially if it's a major like surgical repair of something where you want that healing, you want that tissue regeneration. I don't think it's a bad idea to be off of it for another like 2 to 3 weeks.
Right.
Because plus a lot of people are on pain medication. They're nauseous, they're vomiting. they're constipated because they're not moving around as much. And now you're going to throw in something that's not only potentially suppressing your appetite, potentially making you constipated, potentially making you nauseous. It's a perfect storm for a nightmare. Yeah, you got to give yourself time to recover.
You have to
For
heal.
sure.
Yeah.
I agree. That answered a lot of my questions because I actually was never really sure why you're supposed to get up before surgery. I was like, someone had said something with your heart, and I was like, okay, it's your heart. Like I haven't had a surgery, so I didn't know. Now, what about emergency situations? And
Right, that's okay. Like if you have an appendix issue, like fine, that's where it's important to
But
tell
they
the
need to
provider.
know.
They might put in an NG tube and drain the contents of your stomach if they're concerned that you might have anything left in there.
I actually have a friend who he was really sick. He ended up with a stomach virus. This was like probably 4 weeks ago. He's on Manjaro, and he got like super, super sick. Couldn't keep anything down. Diarrhea, vomiting. Couldn't even keep water down. Ended up in the hospital, and they were like talking about maybe it being Ozempic and or whatever Manjaro, and I was like, I haven't heard this. They were asking me, I'm like, I haven't heard it. I know they were like, is it pancreatitis? Is it this? Is it that? And I'm like, I don't know. I've never actually spoken to someone who specifically had that. But what it ended up being was he just had a really bad stomach virus. But because his gastric emptying was so slow, it actually made him really, really sick. He's able to be back on it again. But it's just he got a bug, and the bug reacted poorly with
I have
being on
seen
the
that though.
Manjaro.
We've had a couple patients more last season that had a GI bug from their kids, and it almost like
It's the
wreaked
same
havoc
time
on them.
too. Remember, it was like the same time when they started, and they wanted to blame the semaglutide. We're like, this is really excessive. Like, are you sure you don't have a bug? And
Right.
they're like, well, there is one going through my house. And we're like, okay.
Yeah, and it just maybe hit them a little bit harder
Yeah.
because of.
Well, I also
being
think
on
it's important to remember, like, when you are losing, and I think this is common knowledge, it's not. When you're losing volume via diarrhea or vomiting, that's major volume loss. That's major liquid fluid loss. So if you're not replenishing that, a lot of times orally you just puke it back up. That's where you do need that IV therapy. And if you don't get it, that's going to cause a lot of stress on your kidneys. And all
that's
your
why we
labs are going to be thrown
provide-
off.
Right.
Every single patient of ours who's on our LH Lean program has an IV complimentary to them
Once a month.
and it has vitamin C and it has
Magnesium. It's a
it's a Myers cocktail.
Well, we could do the Myers, but the one that's included is the amino acid blend.
Yes.
And then it also has a B complex. So some people who have issues absorbing vitamin B.
So let's say you have those weeks that it's hard to drink water and you feel really lethargic. Come on in
Okay.
And
if you remember.
we also have patients who come in and just mention to us, I've been really nauseous. Maybe they're nervous about nausea or this and that. And the vitamin C, they're just feeling their immunity is down. We can always push it. Like same day, we can always add things onto it.
Okay.
Like a Zofran.
As for I need a Zofran prescription, by the way. As for
Low-key throwing it in.
Yeah, I forgot I needed to ask you for that. As for specific vitamins and stuff like that, are there any that you would recommend people as almost like a semaglutide starter pack before they start?
Yeah, I always recommend, I talk about magnesium forever just because it's so
love
great for your bowel
magnesium.
function. It's great for sleep. And I also just think it's great for cardiac function. It's a major electrolyte. It controls a lot of different organs in our body in terms of the contractility and the conduction. So I always like magnesium. It keeps things moving, keeps people
Do you
at
take it?
ease.
I don't take any vitamins.
No.
I'm really.
That's
I
a good
need
base,
to-
like a good baseline would
Yeah.
be that.
Sleep better and you poop. I mean, what's
Okay.
better
I know.
in life?
I need that.
Yeah.
I need to poop and I need to sleep better.
Yeah.
But I'm going regularly, so that's good. I
When
started
you guys
taking
do blood
C-
work. Do you see that if you're low magnesium?
Oh, I just.
We don't order that.
Yeah.
That's like one that you have to order a specific kind to really reflect
And-
the true serum levels.
And which is it? Is it potassium or magnesium that gives you leg cramps?
Potassium, typically.
That's low potassium.
I don't want
So eat a banana
that.
or
I don't
take
wanna
potassium.
take that. I don't want Charlie horse. I fucking hate those.
It's awful.
Yeah.
And that's also a sign of
Wait,
dehydration.
So you're saying if I was getting those, I should take potassium?
Yes.
Yeah.
Oh,
Well, have a banana, like Sue
I
said,
had to tell my
or
sister,
you have to
she
drink
had-
enough water because,
Okay.
even when I was pregnant, I was getting them like crazy when I was pregnant, and they would always be like, "You're not drinking enough water."
Yeah.
And
My
I'd be
dad
like, "I
gets
work
them
in the
all the
ER. What do you
time.
want from me?" Like,
And he's not on the program, but he takes everything, but he gets them all the time.
so that's a good starter with magnesium. Another good one, because I find that everyone's deficient in this, especially in New Jersey or this part of the United States, is vitamin D. We do the injections in the office. Lean members get 20% off, but we do the injection of 25 international units, 25,000. And a supplement is only usually 1 to 10,000 per pill. And remember, you're bypassing your gut.
You
So
can
when
put
you
that in the
inject
bag.
it, no, that one has to be intramuscular because it's oil based. So we cannot put that into a bag, which it stinks, but that has really good benefits for your mood, bone health, muscle health, immunity, energy, And I don't feel like the medical world is there yet. I think if you talk to a naturopath or a functional medicine provider, they're like obsessed with vitamin D. But if you talk to the rest of us, like that were prepared through like a regular university, they don't really fixate on it too much. And even if you look at like your LabCorp and your Quest values, they say that the bottom limit is 30. We like to see 50 to 100.
Okay.
So even if it's not low on your lab results, it doesn't mean you couldn't benefit from some. So those two I like.
Labs done and see where I'm at right now.
And we do blood draws.
Yeah, and they do blood
in-house.
Yeah.
We draw them in house. This was a question that one of
Okay.
our
Can you give me
one of our
numbing cream?
regular no. I'm
she's
I'm
so
so
good. Are you kidding?
I use a butterfly. It's like a kiss from a butterfly. I had one of our regulars come in. He walked in and was blown away, floored. He's like, "Wait, you guys send this to Quest?" And I just looked at him and I was like, "We talked about this." And he's like, "I thought you guys were going to send it to a random lab and I was going to get a huge bill." I'm like, "We have LabCorp and Quest. All you
Yeah.
pay for through us is the draw fee because it
convenience
spends
fee.
us, it costs us time to do
Yeah.
it, time.
We spin
but we
it.
bill your insurance. We
Yeah.
bill your
So you
insurance.
don't have to do anything.
You literally
guys
show
handle it
up
all.
fasted.
Show
We
your-
have LabCorp and Quest drop boxes. They come and pick it up, and it bills through your insurance. And I only did that. One of the reasons why is because people were so quick to tell me, I can't get my labs, I can't get an appointment, the parking, my kids, my this. I'm like, but you come see me every week.
You know what my
So-
excuse is? I
up
hate
early.
walking. No, I hate the hill. I go to the one in Morristown.
Oh,
and
At a
have to
nursing
park,
home.
And if I don't,
I just hate
and-
the vibe in there. I don't like it. They're all in there, white coated, ready to take your blood and put
It's
you
the
in that
smell of, like,
cold
the-
room
the
and
tourniquet.
alcohol and the.
And
I
you
don't
just-
like
you
any
just
of
feel
it.
like
I
cat.
don't like being
There's a
there.
million
There's like
people there.
40 people there in the morning when you try
well,
to
if
go
you're
at 7
if
a.m.
you're anxious about it, on top of that's not
Yeah.
gonna help.
I've had multiple patients who have come in to say to me, like, I hate getting labs done. You're basically forcing me to get them done, otherwise you won't refill my medication.
Yeah.
It actually wasn't that bad here. I'm
Yeah.
coming here anyway. I'll just deal with it.
Yeah.
I
Right.
wouldn't put that as a service offering if I didn't think we were capable of providing
Yeah.
Right.
a good service.
No,
So
I know.
And
you
they
guys
come
are
pick
really
it up,
good, and you'll
like,
baby me.
you know.
You'll like hold me in.
I'll give you the vibrator to distract you.
literally held my mother's hand getting blood work until I was 21.
Yeah. But
Like,
some people
I
just have
made my
that. Like, you
mother
can't
come with
control
me.
I want to
it.
laugh. I had to get blood work when I was pregnant, and my dad took me. I don't know why, because I'm scared. And the lady said to the both of us, "How are you gonna get this baby out?" And I was like, I didn't think about that.
Yeah,
And it
no.
was like, that's the last time.
I just wanted to make one.
Me.
I just wanted to make one. I didn't really think about getting rid of it.
That
Exactly.
doesn't scare me, but a blood drawing needle does.
Well, I was in labor and said
Don't
to my
watch.
husband, if they miss one time, this was both kids, if they miss, I give them one chance, you're doing it. And he's a nurse. Like, it's not like it's
yeah.
a random, but
Yeah.
I remember that was all I was concerned about. I was in so much pain and I didn't care about the epidural, wasn't afraid of getting the thing shoved in my back,
Oh my
wasn't afraid
God.
of anything else. I was like, if I'm already uncomfortable and they miss that IV,
Yeah.
I'm going to freak out.
Yeah, yeah.
Like, I'm
Yeah.
just warning you now. And
No,
he was like,
everybody
all
has
right.
like a horror story.
Yeah.
Yeah.
I have one. I'll never forget it. The image of what was happening, and I'm gonna erase that right now from my memory because I'll pass out. Okay, and then how about on a lighter note, when you're injecting yourself, right? So like I was always doing right side, left side, alternating weekly on my stomach. Occasionally I was doing my thigh. I didn't feel like my thigh was hitting as hard as my stomach was. Do you recommend switching up the sides, switching up your arm, leg?
I think it's good to rotate your injection sites just because you are injecting yourself once a week and you do build up scar tissue over time, right? And even when patients are used to testing their blood sugar, you can look at their fingers, like they literally develop like neuropathy because there's a lot of nerve endings in your fingers and you get a lot of scar tissue. So they always recommend that you rotate your sites.
Okay.
So I don't have anything science-based or research-based to say specifically the change in the absorption, but I would just like to say out loud, if you're injecting subcutaneous tissue in different areas of your body or fatty tissue, the absorption is going to change, right? And if you're injecting it into scar tissue versus fresh fatty tissue, I think there's a difference.
Do you think, because I've had people ask me this, if you do it in your stomach, you're going to get nauseous versus your arm?
I've heard that too, and I think that's very patient specific. Like I
Right.
do think,
I
like
never-
overall, I think there's a change, but I can't like guarantee that you're gonna feel better here versus there. I start everybody in the office in their abdomen, and then I tell them, if you want to try to switch it up, do the back of your
And there
arm.
is a rule about how, like 2 inches from your belly button or something.
Yeah, and I don't really like doing the upper belly because I just feel like it's usually tighter and you're more likely to bruise up there. I always do like the little band below your belly button.
Okay.
I grab a huge hunk of tissue and then I dart it in, slowly inject, let go with
Slow
the
is the
grabbing
key.
hand, and then you pull it out. A lot of people are squeezing it like so tight, shoving it in slowly. It's almost bouncing off. And then they're shoving the injection in, like the liquid, and they're pulling out and they're squeezing and it's bleeding and it's bruising. And I'm like, that was a mess.
That sounds like a
just think you're going to lose medicine. So don't do it that way.
I'm pretty good at it. I just breathe.
Yeah, see, you're already, I can tell you do it
needles.
slowly.
Yeah.
And you hate needles.
And I just say to myself, you're so strong. You're so strong. I'm so proud of you.
Your mantras.
Every time.
But also, it's hard for people to inject the back of their arm at home. So if they don't have a friend or family member, they really can't do it.
I am so lucky
that you don't care. Oh, that you got.
No, that I get it done. Even Danny's for you.
Yeah, I don't. I'm enjoying doing it myself. I feel like
empowered.
Yeah, I do.
Yeah,
I do. But I also, can you tell if you have scar tissue?
Sometimes, like, even when you go to do IVs in patients, I can tell if someone's been poked a certain amount of times. They build up scar tissue.
Can you feel it, like, on the...
Not necessarily, but I do think, like, if I'm going in the needle, it feels, like, physically tough. Some people just have thicker skin.
I think you should add right now that the insulin needles that we provide and that we use are little tiny insulin needles.
They're babies.
Small. They're small gauge.
Yeah.
Small gauge and not super thick. And it's literally what you use to inject insulin in patients in the hospital. So it's meant to only reach the subcutaneous layer. It's not meant to get all the way to the muscle.
Right.
And you'd see like an intramuscular injection, the needle is much longer, like your vaccines. You're both like, goodbye, as I said that.
I
hate those.
And because I'm about to say, I
like
see Danny's testosterone one that has to go in the muscle.
It's
and
like
I'm
this.
like, wow.
He does that weekly?
Twice
a week. And I'm like, you must really feel good, but he looks really good. So whatever, it's working.
Yeah. I know,
and he feels great.
Well, even think about patients that use like IV drug users. That's why they build up scar tissue. Those are the worst patients to get in the hospital. Not because I'm judging them for their habits, but I get anxious when I would try to put an IV in because I knew it was going to be hard to get that needle in. And now it's my problem. God forbid something happens. I can't get access on this patient. They've ruined all their good veins. What do I do? It's all scar tissue. So yes, over time, your average semaglutide patient, no, I think it is good to summarize. I think do the right, do the left, do the right, do the left.
And I
also
always
do love handles, like here.
I always go a little to the right. Like I grab like here and then I'll like go here or I'll go here.
Right.
You have a belly button ring?
I do.
Oh my
Didn't
God,
you say
I
you
haven't
got
seen
it
one in
pierced?
such a long time.
Mine is gone.
I got to put back in Miami. But I had it out for a while.
So cute.
Trying to be like cool, vintage, and prepare for my ring. Like I'm trying to like get all my
your other bling in order.
So everything looks good.
Plus, it's boat time.
Yeah,
it's boat time.
It's boat time.
I know. The last thing, shelf life of the medication. I know I mentioned this in one of the episodes. I had a vial that, like, because I was spacing it out so long, it had
and doing really low doses.
It had lasted me a while. So, do you feel like there's something to be said about that? Because when I opened my new one, I was like, ooh, that one burned today. And then I was like, well, wait a second, I just opened a new vial.
Two things to say about that. First thing is if you were a patient who I didn't speak to literally all the time, I'm like, where have you been? Because if you're using the same vial that I prescribed you over 12 weeks ago, literally, what are you doing?
Right.
Like,
yeah, how's that working?
How's that working for you? And also, even if it was working for you, like what has happened in your life since I talked to you months ago? I've had a couple patients. I kid you not. So multiple patients have been like, I had this procedure done, I had that done, and I went away here, and I got really sick and now I'm furiously trying to write this all down to document it and also make recommendations. And then I'll even go back and be like, yeah, if you had told me that 6 weeks ago, I would have put you on this path, not on the path that you're on.
Right.
So that's one issue is like, I don't know what you're doing. And that's why we design it to say, in order for you to be on our program, you have to talk to us once a month for 12 weeks in order to get your next shipment, because now I at least have some accountability with you that I can check in and know what you're doing. Yeah. The second issue, and we talk all the time, so that doesn't actually apply to you, but the second issue is potency and also just contamination. Like potency of the medication, you crack the lid off something, you start introducing it to air. Yeah, you're putting it through the rubber stopper, but you're introducing needles and air to that vial. So now, in my opinion, like the potency just isn't guaranteed anymore after the 30 to 45 days. Like in the hospital setting, once you open it and actually start introducing air to it, we chuck everything. Right. It's not meant to be left out. Second reason is because of bacteria and growth of organisms.
Ew.
After it's open, certain needles are not necessarily sterile. Like those multi-packs of needles that are sent to you, they don't need to be sterile. They're not supposed to be. There's a difference between clean and sterile. So now you're introducing needles, you're putting it in the fridge next to your food. Think about all the microorganisms that are on the surface of that stopper, and now you're introducing the needle.
Next to your lettuce and fruit.
I put it back in the box back in the bag, tie the bag shut, and
and like your risk of really having this crazy infection is like, but that's where like
people are trying to hide it and like what's around it. And next to your Arm and Hammer, if you have one, which I hope you have one.
That's where James's is. It's next to the Arm and Hammer in the side. So like I'm not sitting here like fear mongering and being like, oh, you're gonna die up the stairs.
Just think about it.
Yeah, and that's why it's designed that way. Like patients will try to like work out these hypothetical situations with me, and I'm like, I'm here to tell you, I write you a 12-week prescription. The pharmacy fills it. You open a vial. It has 4 to 6 doses in it, which should make the 45 days. Chuck it even if there's leftover, because I've had patients even save it and say, well, I didn't finish it, so like I just wanted to finish that one out first. Get rid of it after the 45 days. Let us do the work and the math to figure out how much to give you. It's almost like holding onto an antibiotic to stockpile it for a year, and then you think it's actually gonna have the same potency. Right. It's not.
When you draw it and it's cold when it comes out, like, okay, so what I'll do is I'll take it out of the refrigerator, I'll draw it up, I'll put the caps back on, I'll leave the syringe, I'll go upstairs, take a shower, whatever, and then when I come back down,
I think that's fine.
I do it. But someone said, when I said it burned the one time, they were like, make sure that you're not doing it cold.
And letting the alcohol dry. Like if you're cleaning the area with alcohol,
that makes
you don't clean it with alcohol. You've admitted this to me because you're like, why shower? But that is something that people have said. If you clean it with alcohol and you don't let it dry, it'll burn. But also sometimes the diluent, like it can be mixed with like saline or like bacteriostatic. A lot of times that can burn. It's the same with Botox. We've had patients say that it burns with one versus the other.
Yeah. Okay. And NAD burns with one.
What is NAD?
NAD is a peptide that I'm taking, and it's supposed to improve my memory, but we're not there yet.
We all have NAD in our body, and as we get older, the natural levels of it decline. So it's like it's an analog of like B6, like a vitamin.
Okay.
I really think it's a mood enhancer.
Okay.
It was really working well until I took one that was expired, and then the whole thing made me spiral.
I got the phone call for that.
And this was just Monday. What's today? Wednesday?
Yeah.
Today's Wednesday.
Oh shit.
Yeah. So
well,
I blame my week for the expired NAD.
Shit.
And it's not expired, by the way. The bottle doesn't say it's expired, but it's that 45-day thing.
Because it's
turned
been open.
Orange. So we call Meg, and I'm like, is it orange or is it clear? She's like, clear. I'm like, shit, it's orange. She's like, truck it. So to this point of this conversation,
it's good that it tells you though. I wish the semaglutide did that.
But it got just like Sema gets in my head like mindfuck. So did the NAD.
Yeah.
And the Sema does have a beyond use date, but that's based off of if it's not opened.
Right.
I'm very stickler on the 45-day thing because I've experienced it.
Yeah. No, you gotta be. Okay, so I think we're all.
Sorry.
Oh my god, teacher.
No,
I think we're good.
Yeah.
Right?
Yep.
I think
your
we're
son's
good.
birthday today.
I know, it's Luca's birthday. Everyone wish her.
And my mom just
birthday.
has her little part-time job, and she fell at work with her this podcast. Like, yeah, she's so clumsy.
We're getting hit
the stress
from
like
every angle
in the world.
All three of us. We had a phone call last night. I think
we should have just talked about our week. Maybe it would have been very entertaining because you can't not make this shit up.
I'll need a tall glass of
anything. Tequila.
But then I would have cried.
Okay, so that's all we have for today. Thank you guys for watching another episode of The Unweighted Life. We will be back again next Friday with a new episode. Bye.
Bye.